Good afternoon, dear colleagues. My name is Tatiana Klets and I am pediatrician and philosophy doctor. Today we will talk about peculiarities of children's skeletal system, main clinical significance of these features, and semiotic of main diseases. Bone system late on the second month of prenatal life. Cartilaginous tissue formed from the mesenchymal cells. And the process of ossification or replacement of connective and cartilage tissue by bone begins in the intrauterine period and lasts until the onset of puberty. The skeletal system of children has the following features. Bone plates are chaotic. Bones contains more cartilage tissue and more water, and less mineral substances. And periosteum is elastic. That is why bones in young children are more elastic, softer, and less fragile. Bones rarely break, but easily deformed. And fractures of children's bones are without rupture of periosteum, which called green branch type. At this picture you can see the example of green stick or green branch fracture. Next distinctive features of the children's skeletal systems are presence in newborns some seams, like sagittal, coronary, lambda-like, and skull bones in newborns are shifted. Newborns have opened fontanelles, front, rear or back, and two lateral, but only in deep premature newborns. Violation of the terms of closure fontanelles may indicate a pathology, like rickets, hydrocephalus, etc. Teeth in babies appears from 6 months. First stage is appearance of calf teeth, and next stage is replacement for permanent teeth. In 1 year, normally 8 baby teeth should be. For assessment amount of calf's teeth, doctors use special dental formula, where number of teeth is age of the children in the month minus 4. So in 2 years should be 20 calf teeth. Belated eruption, violation of the sequences, and improper placement of teeth are the signs of pathology. The chest in childhood is also different. In children of first months of life, the barrel-shaped form of a thorax. Ribs fasten at right angles, and excursion of chest is sharply limited. That is why children have the superficial type of respiration. In newborns and children of the first months of life, the spine is straight and has no physiological bends. The spine acquires the S-shaped shape with the growth of the child and the development of static function, up to 1.5 to 2 years. Let's summarize what peculiarities of children's skeletal system are. They have thick periosteum, weak mineralization of bones, rich vascularization, specific form of the chest and pelvis, imperfection of the chewing apparatus. The bone system in childhood is a marker of biological age and has intensive hemopoietic function. The scheme of timing of ossification is used by various specialists like genetics, endocrinologists, and so on. Let's consider some examples of semiotic of major diseases of skeletal system. One of them is imperfect osteogenesis. These patients are called crystal men. Their bones are very fragile and minor trauma may lead to multiple fractures. That is why they have a lot of bones deformations. Chondrodystrophy is the next example. These patients have normal size of head and trunk, and their extremities looks disproportionate because their limbs stop their growth. One of the most common pathology of the skeletal system in childhood is rickets. The symptoms of early stages of rickets are bald nape and head sweats. In severe cases, or X-shaped deformation of the limbs may be present. We can see also some rickets symptoms on the chest, like Garrison's furrow and rosary of the ribs. On the hands we can see the thickening of the diaphysis of the tubular bones in rickets. They called rachitic bracelets and thread of pearls. Rickets chest means the expansion of the lower aperture of the chest. The symptom of frog's belly is decreased abdominal muscle tone. In some cases of rickets or other diseases of skeletal system, pathological form of chest may be present. At this picture you can see keel-shaped deformation of chest or chicken chest. Another example is pushed chest or shoemaker's chest. Why is the name of this deformation so strange? In ancient times, shoemakers pressed their breast on a specific pad while working, and it led to some deformation of their chest. Increase of head size and deformation of the skull may be the signs of hydrocephalus. In these cases, intracranial pressure is increased and brain is compressed. At these pictures, you can see some patients with hydrocephalus. It's a very severe disease which leads to damage of central nervous system. Dysplasia of hips is also very often disease in childhood. In this case, the roof of joint is sloped, and the femoral head is poorly fixed in the joint cavity. One more scheme of hip dysplasia. Pay attention then on the right part, Shenton and Maynard's line is broken. For diagnostic hip dysplasia, doctor must check Barlow and ortolani symptoms. Pelvis distortion is a consequence of hip dysplasia. Dear colleagues, we have completed discussion of main peculiarities of skeletal system in childhood and semiotic of major diseases. Thank you for your attention.